Hello dear viewers, welcome to Pharmacy Day by Asim, and today's video we are going to talk about diabetes. So diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys and nerves. Diabetes is a major cause of blindness, kidney failure, heart attack, stroke and lower limb amputations. Diabetes is mainly divided into two main types, type 1 and type 2 diabetes, and today we are going to see the difference between these two forms of diabetes. So let's get started. Type 1 diabetes is also called insulin-dependent diabetes. It is used to be called juvenile-onset diabetes because it often begins in childhood. Type 1 diabetes is an autoimmune condition. It happens when your body attacks beta cells in your pancreas with antibodies. The organ is damaged and doesn't make insulin. Type 2 diabetes used to be called non-insulin dependent or adult onset diabetes, but it's become more common in children and teens over the past 20 years, largely because more young people are overweight or obese. When you have type 2 diabetes, your pancreas usually creates some insulin, but either it's not enough or your body doesn't respond to insulin. About 90% of people with diabetes have type 2 and about 10% of people have type 1 diabetes. The underlying causes of type 1 and type 2 are different. Type 1 diabetes is believed to be due to an autoimmune process in which the body's immune system mistakenly targets its own tissues, islet cells in the pancreas. In people with type 1 diabetes, the beta cells of the pancreas that are responsible for insulin production are attacked by the misdirected immune system. The primary problem in type 2 diabetes is the inability of the body's cells to use insulin properly and efficiently, leading to hyperglycemia, high blood sugar, and diabetes. This problem affects mostly the cells of muscles and fat tissues and results in a condition known as insulin resistance. Signs and symptoms of diabetes, whether type 1 or type 2, do not differ. The classic symptoms are the same for both diabetes type 1 and type 2, which include number 1, increased urine output, polyuria, number 2, increased thirst, polydipsia, number 3, increased hunger, polyphagia, number 4, unexplained weight loss. For both type 1 and type 2, early symptoms of untreated diabetes arise due to elevated blood sugar levels and the presence of glucose in the urine. High amounts of glucose in the urine can cause increased urine output and dehydration. Dehydration in turn causes increased thirst. A fasting blood sugar measurement can be used to diagnose any type of diabetes. This test measures the level of sugar glucose in the bloodstream in the morning before eating breakfast. Normal fasting plasma glucose levels are less than 100 milligrams per deciliter. Fasting plasma glucose levels of more than 126 mg per deciliter or two or more tests on different days indicates diabetes. A random non-fasting blood glucose test can be used to diagnose diabetes. A blood glucose level of 200 mg per deciliter or higher indicates diabetes. Now let's talk about the treatment for diabetes. So insulin is the treatment of choice for type 1 diabetes because the body responds appropriately to insulin and the problem is a lack of insulin production by the pancreas. Treatment for type 2 is more complicated due to the fact that the body may produce enough insulin but not be able to use this insulin effectively. For many people with prediabetes or early stage type 2, lifestyle modifications may be sufficient to control the problem. These can include regular physical activity, weight loss, and following a healthy diet plan to avoid becoming obese. When lifestyle changes are not enough to control blood sugar levels in people with type 2, medications like metformin, sitagliptin, and glipizide may be added. If we talk about the prevention of either type of diabetes, there is no known way to prevent type 1 diabetes, and for some people, it might not be possible to prevent the development of type 2. For others, maintaining a healthy weight, getting regular exercise, and a healthy balanced diet may help prevent or delay the onset of type 2 diabetes and thus preserve health. So that's all for today. Hope you like this video. For more amazing content about pharmacy and medicine, please like and share this video and also subscribe to my channel Pharmacy D by Asim. Thank you.